Hi everyone, Ron Crider reporting for the duty station today. Here I am with the numbers for today. I don't have the numbers right this minute, but they'll be coming up here a little bit later on in the video. Today was a busy day. I first started out going over to Premier Dental to have my teeth looked at, which I do every 3 months. And here's a picture of myself and Kimberly at Premier Dental. They do a really terrific job. Kimberly is absolutely the best. Love her. Then I went over to see Rosie over at the Scully Walsh Cancer Clinic, and I gave her one of my little vaccination bracelets that I wear. See, I wear one of these everywhere I go. It says that I've been vaccinated. That's a pretty cool thing. She saw it. She liked it. So I said, I got plenty of them. I give them away to everybody I run into who sees it, likes it, and wants one. I'll be happy to give them to you. So that's what I did then. And then next, I want to say something that I didn't say yesterday. I didn't give Dr. Pagnini any credit for my radiation treatments, which went really well, so much better than anybody had expected. So it's Dr. Paul Pagnini over at the Scully Walsh Cancer Clinic here in Vero Beach. Wonderful job. And my whole team, my medical team, Dr. Mason and Dr. Hal Brown, those guys are really, they're a real team. They work as a team. They're all related to the Cleveland Clinic. And I have to tell you, it's great to have a medical team. Dr. Brown has joined the staff, so to speak, at the Cleveland Clinic. And so now Brown and Mason, Dr. Brown, Dr. Mason, and Pagnini, and all these guys are all under the roof of the Cleveland Clinic. Now he still has his practice across the street from the hospital, but they're all related within the hospital. This makes it very cohesive to get medical treatment and keep your records straight and all that sort of thing. So I think it's really a good thing. And, Italians talk with their hands. So my hands are moving again. I'm sorry about that. Just want to give him credit because Pagnini was the guy who headed up Dr. Pagnini was the one who headed up the radiation team, and those guys were really exceptionally good. Then, in addition to that, I have to tell you about the corned beef and cabbage I got over at Crider's yesterday. I showed you a little picture of it. I had a little bite before I did the video. I ate another piece of it last night, and it was absolutely spectacular. I'm so glad I got it over there. Everything they have is really good. I also got a chicken pie for somebody else, and they really liked the chicken pie that they had there. So this is at Crider's on Cardinal here in Vero Beach, right across from the Tides. Go in there. Crider's Gourmet Market. Used to be a fast food type place, a place where you go in and grab a convenience store. That's not a convenience store. It's a convenient gourmet store. And Tom Crider is the real deal here in town, and we are so lucky to have he and his family here who opened up that little store. I mean, what the heck? They come down here to retire, and they open up a little store, and it's a fabulous little store. And he has 2 chefs back there in the kitchen cranking out really good stuff. So stop by and see those guys over there as well. As far as the weather's concerned today, let me tell you briefly, it's very good. Other than this evening, we're going to have a couple of little storms overnight. And the temperature tonight's going to drop down to about 66 degrees. And then tomorrow, a few clouds early, but otherwise mostly sunny all day. Tomorrow, the temperature is going to be 83 and a low of, it says 64 degrees in the morning. Other than that, it's going to be really, really good. Now, this next news clip that I'm giving you, in the past, I would tell you this stuff, and you say, hey, Crider, what does he know about this stuff? So I'm going to let Dr. Glen Morris tell you about it as well. Dr. Morris is a professor at the University of Florida. He's in the medical department up there. And this is really good information. It's about the variants of the virus and about traveling and so forth. So we're going to jump right into that right now. As soon as we come out of that, I'll have the numbers for you today. And as you notice, I've been putting these things up pretty quickly. So sometimes I'm getting them up before 6 o'clock. Yesterday, it was up even before 5. I hope you have a really blessed Thursday, one more day in the week, and I'll see you back here again on Friday. But I'll see you here towards the end when I show you the actual numbers for today. They can't be possibly as good as they were yesterday because the numbers yesterday were green on the screen all the way around. Deaths were down, positives were down, the positivity rate was down, 7-day moving averages were down. I think they just wanted to put green on the screen because it was St. Patrick's Day. I hope I'm wrong. Unfortunately, I probably will not be wrong. But anyway, back in a flash with the numbers, and here we go into the video. Don't forget to push that like button. I sure do appreciate that. Thanks a lot. See you back here in a second.
The Centers for Disease Control is urging Americans. It is encouraging people to mask up. Health experts are voicing concerns about the pace of reopening in some states, with a number of more contagious variants spreading rapidly across the U.S. The CDC is calling two strains first detected in California the variants of concern. Meanwhile, the Department of Health and Human Services says it will distribute $10 billion to help states implement coronavirus testing in K-12 schools. The money is part of the Biden administration's $1.9 trillion American Rescue Plan. The president has set a goal of reopening most schools within his first 100 days. Dr. Glen Morris joins me now. He is a professor of medicine and director of the Emerging Pathogens Institute at the University of Florida. Doctor, welcome. Thanks very much for being with us. While cases are still decreasing nationally, some states that lifted coronavirus restrictions are already seeing either an uptick in new infections or a slowdown in declining cases, specifically Minnesota, Maryland, New Jersey, and the metro New York City area. From a public health perspective, doctor, does it make sense to move forward with reopening businesses?
I think there's probably a need to slow things down. Again, what we're seeing here is that people sort of feel like it's all over. I'm fine. I can get out. I can do anything I want to. But when that happens, they get out. There's the potential for exposure. We've had a number of people who have received vaccine. We've had a number of people infected, but we still are not anywhere near the herd immunity level where we can expect to see significant drops in transmission rates. We're getting there, but it's still important right now to continue to be careful and to follow the CDC recommendations.
Well, TSA reported the most travelers since the pandemic began over the past weekend. We are now at some 2 million vaccine doses being administered every day. Should those who have been fully vaccinated feel safer to travel?
I think they can feel safer, but I think it's important to continue to maintain the mitigation strategies, the recommendations that CDC has put out. Masking remains important. And again, one of the things we're concerned about are these variant strains. They, have the potential for causing disease in individuals who may have had prior exposure either to the virus or to the vaccine. And so consequently, until we get things under, a little tighter control and numbers really start dropping, continuing to wear a mask and continuing to follow the CDC recommendations makes sense.
And doctor, what is your sense on how the country's vaccination efforts measure up against the variant strains?
Well, I think the vaccination efforts per se are going quite well. Again, as you pointed out, we're pushing 2 million vaccines administered per day. I think the key at this point is going to be to begin to shift over and start looking for populations which have had some hesitancy about getting vaccinated. We're not quite there yet, but we need to really start looking at some of the minority populations, some other high-risk populations who have elected not to get vaccine right at this moment. And I think, again, over the next couple of weeks, months or so, we will begin to shift over away from sort of the mass vaccination type strategies we have and focusing more on particular groups and hard to reach groups. In terms of the variants, the key here is that we want to try to keep the numbers of cases as low as possible. What happens is that when you've got a lot of virus circulating out there, then the viruses are going to evolve. And as the viruses evolve, one creates variants. And some of these variants may have the appropriate genes to be able to cause illness in people who have been vaccinated. So consequently, the critical thing at this point in time is to try to keep things under control, minimize transmission, wear a mask, follow CDC recommendations, and absolutely get vaccinated when you have the opportunity to do so.
Well, public health experts have said that getting any of the current vaccines should offer some protection against serious illness and death from coronavirus variants. But we know that pharmaceutical companies are trying to take a more proactive approach. What are some other options that are in development that may be available in the near future?
I think the key is probably to move forward with what have been called booster doses. And again, this gets back to the idea that viruses evolve all the time. And in fact, with influenza, we're very familiar with this because each year we have to come out with a new flu vaccine, which is targeted toward these specific vaccine strains, which are circulating at that point in time. We're seeing a similar type of effect here, where we have one strain that, or, fairly closely related group of strains that were causing the initial outbreaks. As time passes, as more and more people become infected, we see evolution within these strains. And just like was with flu, one has to switch the vaccine a little bit. The same thing is going to be happening with coronavirus. We will need to make some modifications in the vaccine. And again, this probably is most easily done, at least in the short term, by using some type of booster dose for those individuals who've already been vaccinated.
Alrighty, folks, here we are in the numbers department for March the 18th. Today is Thursday. I do have the numbers for you. Yes, unfortunately, the numbers did go up pretty much as predicted, although the positivity rate, check this out, is at 5.56. It's one little point below 5.57 where it was yesterday. Alrighty, for the number of deaths for the entire state of Florida, 83 new deaths reported in the past 24 hours. That's 25 more than yesterday. Number of positives for the entire state of Florida, 5,093. That's 494 more than yesterday. Then we take a look over here at the number of vaccinations in the past 24 hours. 106,503, and then the total number of vaccinations for the entire state of Florida since we started was 4,570,538. Alrighty, folks. Now we'll go down to Dade, Broward, and Palm Beach County. Let's take a look first at Dade. Dade County, Dade, Miami, 11 new deaths to report in the past 24 hours, 1,108 new positives, 17,119 new vaccinations in the past 24 hours. Broward County is Fort Lauderdale, 3 new deaths to report, 712 new positives, 9,087 new vaccinations down there. In the Palm Beaches, Palm Beach County, 8 new deaths to report in the past 24 hours, 382 new positives, 5,117 new vaccinations in the Palm Beaches in the past 24 hours. In Orange County, we call that Mouse Town. That's Orlando. 8 new deaths in the past 24 hours. 322 new positives, and 5,008 new vaccinations up there. We'll go over to the Space Coast, which is Brevard County. 3 new deaths to report, 85 new positives, 3,504 new vaccinations in Brevard County. We're going to go down here a little bit further to St. Lucie County. That's Fort Pierce. 1 new death to report, 62 new positives, 738 new vaccinations there. And then in Martin County is Stewart. 4 new deaths to report, 22 new positives, 525 new vaccinations. You can see the vaccines are slowing up here a little bit. Getting into Indian River County, look at Indian River County. Only vaccinated 280 people in the past 24 hours, but we did have no deaths. That's a very good thing. And 19 new positives. So the problem we're having now is that aren't going to be getting any more J&J vaccines for a couple of weeks for some reason. I'm not exactly sure what the story is there. So that's kind of a bit of a problem, and that's putting a crimp in our style of getting more shots in people's arms here in our county. Now let's go down here to Indian River County and take a look at the zip codes for Indian River County. They do balance today, 19 up here, 19 down there. That's a good thing. Zip code 32948, no new positives in the past 24 hours. Zip code 32958, 3 new positives. Zip code 32960, 4 new positives. That's Vero Beach proper. Zip code 32962, 3 new positives. Zip code 32963, that's the Barrier Island, 3 new positives. Zip code 32966, 4 new positives. And zip code 32967, 1. Zip code 32968, that would be 1. Let's scoot down here just a teeny bit and take a look at the 7-day moving averages and see exactly what this is all about. Well, sorry about that, folks. You don't get a green there. It's going to have to become a red because yesterday it was 74. Today it's 77.57. So it's going to be red on the screen for that one there. 7-day moving averages, meaning approximately 77 people passed away each day for the past 7 days as a result of COVID-19. So it did go up from 74 to 77.57. All right, here we go with these really terrible numbers. USA cases since we began, 29,643,005. Those the number of cases here in the United States, 29 million cases. Number of deaths here in the United States as a result of COVID-19, 538,588. And then we go over here and take a look at the number of people worldwide that contracted COVID-19 since we started, 121,549,000. I don't even count these little guys over here. And then we have the deaths, the number of deaths worldwide, 2,685,314. Okay, folks, those are the numbers for today. I hope you liked that little video piece I brought you just prior to the numbers because I thought that was pretty interesting. He gave quite a bit of good information, a professor from the University of Florida. And from time to time, we're going to have him with us again because he does give out very, very good information. But you heard what he had to say. He says, we're not there yet. We're not there yet. Please get that through your head. We're just not there yet. We still have to social distance. Probably wearing a mask is a good thing. And yes, you have to get vaccinated. I don't care what President Trump said. Yeah, I'm a real right-wing type guy, and I'm a real Trump guy, but he does everything he says isn't absolutely correct. And he got a shot, for heaven's sakes. There's no reason why we all shouldn't get shots, and I got mine, and I got my little green badge here to let you know that I got it. So, alrighty, folks, it's Thursday. Coming back here tomorrow. See you back here then. Thank you very much for watching. Don't forget to push that like button. I appreciate that so much. See you back here on Friday. Have a blessed Thursday evening. Ron Crider, signing off.